You wanna be on top? Wanna be on top? It's time to make it happen. You know that we don't stop.
Good morning, one and all. It's the show that no one should miss. Join us as we find out just who will be CGH's next role model. Our challenge for today is each one of you will be assigned to a patient who is for discharge. Now, I want you guys to provide me the correct, the best, and the most complete discharge instruction for our patient and her guardian. So, if there are no questions, let's get this challenge started.
Good morning, miss. Your task for discharge.
That's good news, Doc.
I came to give your discharge instruction.
I'm more than willing to listen and take down notes, Doc.
You were diagnosed with acute severe diarrhea. For your 2-day hospital admission, you were given ciprofloxacin. You were also given oral hydrating fluid. You would have to continue taking ciprofloxacin 500 milligrams.
Okay, Doc.
I'll go ahead now. Thank you.
Oh, okay, Doc. Thank you.
Wanna be on top?
First up, Dr. Paul Klein.
Dr. Paul Klein, everything was perfect except for one very important detail. You failed to ask the patient and the guardian if they understood what you were saying.
Yes, Dr. Paul. I have to agree with Dr. Kristen.
I want you to remember, Dr. Paul, what the two judges are trying to teach you here is a teach-back technique. It is a patient-centered communication style that provides every effort to make the instructions as clear as possible and that the patient has actually learned and processed what we are trying to teach to avoid miscommunication issues. I hope I made my point clear.
Next up, Dr. Derek Clarkson.
Good morning, ma'am. How are you feeling today?
I'm feeling a lot better, Doc.
Let's see. Your condition has been stable the past few days. You're ready to go home.
I can't thank you enough for taking care of my daughter, Doc.
You're welcome. Here is a list of her take-home medications. Just make sure she takes them. If I may be excused, I have other patients to attend.
What do you think OD means?
I don't know, Mom. And when should I have my follow-up checkup?
Dr. Derek seems to be very busy, but I still think he should have explained this to us thoroughly.
Dr. Derek Clarkson.
I'm extremely disappointed with your performance, doctor.
I agree. You were not able to communicate effectively with your patient. You did not explain the instructions for the take-home medications. You were not able to warn her for the possible adverse reactions. And you did not even indicate when you will meet her for the follow-up checkup.
What were you thinking? Do you think discharging a patient is as simple as handing him or her a discharge slip?
We hope you've realized the importance of effective communication during discharge, Dr. Clark. We all want our patients to go home safe and healthy, and we can only achieve that if we take the time to educate our patients during discharge.
Good morning, ma'am. I'm Dr. Raine, your attending physician, and I think you're ready to go home today. But before you leave, I need you to give yourself those insulin shots that you have been receiving from the nurses. And I also want you to learn how to monitor your blood sugar using a glucometer. The nurses will come and teach you. You can also teach your family members so they can help you too. So you might probably be wondering why you're getting different insulin shots. The nurses have been giving you insulin 4 times a day, right? This is because you have diabetes, and we're gonna provide you a written schedule when to give your insulin and when you need to check your blood sugar so you won't forget, okay?
Okay.
You might have cold, clammy skin or feel a little lightheaded, and when this happens, I want you to drink anything with some sugar in it so it could bring your blood sugar back up. And if you're unable to do this, I want you to call for help, okay?
Okay, Doc.
And lastly, I need you to come back after 3 months for the follow-up checkup. Now I want you to tell me about what you understand and what are the 2 things that I want you to do before you get discharged.
Okay, so I have diabetes, and this means that I have high sugar levels in my blood. And that is why I need to receive insulin every before meal and before bedtime in order to bring it back to normal. And the 2 things that I'll do today is I'm gonna give myself a shot before meals, and I will be checking my blood sugar with the glucometer. I need to eat quickly and give myself a shot during the day, and if I start to feel symptoms like lightheadedness, so I need to take some sugar or some candy. And the other thing is we're gonna meet in 3 months for my follow-up.
Very good.
Thank you, Doc.
You wanna be on top?
Dr. Raine. You've raised the bar high. You explained to the patient the reasons for current admission and what transpired in her hospitalization. You prepared a comprehensive discharge summary with a complete discharge medication list, detailed medication information, details of ongoing medication management plan, and medication management needs.
You educated the patient prior to discharge, potential side effects, and gave an emergency number to call when the need arises.
And most importantly, you reinforce the teach back technique.
Dr. Raine, you are CVGH's next role model.
I can't believe I won CVGH Next Role Model. I've always valued the essence of effective patient communication. Rest assured, I will apply in my practice what I've learned and still continue to do my best because I know I still have a lot to learn. Thank you very much. I am CVGH Next Role Model.